Welcome back to the Better Health Now podcast. Today I have the opportunity to sit down with Nichole Brooks, a nurse practitioner here at Coleman Regional. Super excited to have you here today. We're going to talk a little bit about what overactive bladder is. Give the listener just sort of an overview on what is overactive bladder and kind of how does it affect people.
So overactive bladder is where your bladder has an involuntary muscle contraction that prompts you to go more often. You have feelings of urgency, and it's hard to defer going to the bathroom.
And so, is this is this ever dangerous, or is this an indicator of other serious health concerns?
Sometimes it can be. When someone comes in with those complaints, we go through a thorough history and exam to see if we can figure out what might be the cause. There are many. It can be medication side effects. It can be a neurologic, problem or other issues that are a little bit deeper.
So looking at OAB, who does it typically affect, and what are the patients that you typically help treat with OAB?
Okay, so it is very common. It mostly affects females, but it affects men as well.
And so, as far as some of the different causes of OAB, does it get to just age make it cause, or is there other sort of symptoms or other sort of indicators that maybe OAB could happen?
So it's kind of misunderstood to some degree. People assume it's just a part of getting older, which it isn't. It's actually a treatable condition that even younger people can have. We see a lot with diabetic patients, people that can have, of course, other neurologic disorders like Parkinson's or MS.
And as far as the treatment's concerned, talk a little bit about sort of the non-surgical and surgical treatments, and then what you typically see from patients that come in.
We will, when you come in, we will take a good history, kind of see what's going on. A lot of times, lifestyle changes, little tweaks that we can do in our day-to-day life, and being aware of what's going on can kind of help. Yeah. But say when lifestyle changes or we implementing those don't really make a difference, we will go to usually a trial of medications. And if someone does not do well on meds or it doesn't help, then we move on to the next thing, which can involve some procedures.
Yeah, and it's like the underlying theme of our podcast with Better Health Now. I mean, it's making it not seem as though it's just something that's inevitably going to happen, that you can still live a lifestyle that you want to live, and you can have OAB, but you can treat it and you can still do the things you enjoy.
Absolutely.
And so, as if someone's listening and they think they maybe have OAB, what sort of the next steps that you would recommend for them?
So one of the things I like to say is make sure you tell your healthcare provider, your doctor, whoever you're seeing, do not be embarrassed. It's way more common than people realize. So say something to your healthcare provider, and they can kind of start the treatment or kind of work with you on things. And if, you would like to see someone in urology, then I would say call us and see about getting an appointment.
Yeah. And so as we kind of wrap up the conversation, what's sort of the key takeaway that you want people to understand about OAB? Maybe if they have a loved one that has it, maybe if they themselves think they have it, like what is the kind of the lasting remarks that you want to have?
So it really can affect someone's quality of life. They may choose not to participate in activities in their life because they're embarrassed or they don't know where the bathrooms are going to be. And that's something that we don't want you to do. We want you to be involved and continue your normal life. So getting treatment for it can absolutely improve your quality of life. There are treatments for it, and I encourage you to speak up.
Awesome. Well, I appreciate you being here today. We'll have information in the episode notes with more information regarding OAB. So if anyone has any questions or wants to find phone numbers to give Coleman Regional a call in any department, they'll have links there. But I appreciate you being here.
Thank you.